Well, the word doctor means teacher.
Mm-hmm.
I see myself as a teacher. The word physician is healer. The reason why I teach, it keeps me sharp. It also gives me the opportunity to have a legacy. You know, your students are the ones who are going to carry your legacy on. So I must admit, and I am not so proud of this, but I like bright students. I am not, my wife is quite interesting. Uh, she teaches autistic children, and I just wonder how could somebody have that kind of patience
Mm-hmm.
to work, you know, like that. Me, I like bright students. I don't like arrogant students. I like bright students. I like people who are inquisitive. So I like students who are going to challenge me, who are going to make me go back to the books. You know, you asked me a question and I really didn't have a full answer. One of the things that I do in my practice is we do a lot of teaching. I teach, I have medical students, I have nurse practitioners. So we always have a student. Today I had a medical student in the office. I had a nurse practitioner student, and simultaneously. So I'm going from patient to patient, area to area with different students. And my patients, they're used to it. And they're comfortable with that. They know one is I won't let the student loose on them. That student will be right close to me.
Mm-hmm.
That student will not do anything without me being aware of it. But, and one of the things I always make sure that the students realize is their limitations and the privilege that a patient may give them to give them the opportunity to learn. So in that setting, you know, education occurs, but not just education occurs, healing occurs. One of the things that the students bring to the practice is they give patients are always starved for time. They want more time with that health professional. They want more time with the nurse. They want more time with the doctor. Students have that. They have time, and they also have knowledge. So all that comes together,
Mm-hmm.
and that's what I like in the patient encounter.
Mm-hmm.
I like to have students for those reasons. When I was taught, when I was a medical student, we were expected to be extremely detailed with the work that we did. You know, we were told, you are a student. You are not here to work. You're here to learn. The residents, they are working. They're learning differently. You don't do what the residents do. You do what the students do. So they would give us a patient, and we would talk to that patient. And at the end of that discussion, we would sit down and we would write 10, 15-page write-ups on these patients. We wouldn't just, so how's your headache? Where does it hurt? Da 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 da. No. We would have to really get details. Now, how does that impact medicine? I'll give you an example. I remember my wife was having chest pain. So she went to a colleague of mine, and he did what 90% of the doctors would have done. He did a bunch of tests. Boom, boom, boom. He looked at the tests and he said, "Oh, tests are fine. You're okay." She didn't buy that. So she was still having this discomfort. So her mother told her about this doctor, who I happened to find out later on was a pretty well-known cardiologist at Mount Sinai, the dean of cardiology, they would say. And he went to see her. She went to see him. When she got there, she went in to the consultation and she spent a long time, probably close to an hour. At the end of towards the end of the visit, he called me in. I was in the waiting room, and he basically gave his conclusions. And then he said, everything is fine, don't worry. So she left, and her problem went away. Problem went away. He didn't do a test. He didn't do anything. He just reviewed what the other doctor had done. About a month later, I guess, since she wasn't referred, he didn't have anywhere to send a consultation report, so he sent it to me. I read that report. What this famous cardiologist did was a medical student write-up, the kind of write-ups I was used to seeing when I was in medical school, where you would basically study the person. The point is this: how can you tell me what's wrong with me if you don't know me? How can you know me if you didn't talk to me? How could you didn't spend any time with me. You just did a test. I don't care about that test. You know, this when the Affordable Care Act, so-called Obamacare, came in, you know, I was paying a lot of money for my health insurance. So I said, maybe I'll go on this exchange and I'll get some cheaper insurance. So I went on the exchange. I dropped my insurance, went on the exchange, couldn't get anything that was of any value to me. So I went back to my previous insurance company and I said, oh, okay, I want my insurance back. They said, oh, you can't get that anymore. We don't give that to you anymore because you're a small business. However, you can get this other one. So what I had before was sort of the equivalent of a platinum plan. So they gave me this gold plan. So this gold plan then required that in order for me to see a specialist, which I wanted to see, I would have to go and see a primary care physician first. So I'm saying, geez, why do I have to go see a primary care? Anyway, maybe it's a good thing. I need an exam. I need a good checkup. I need to make a relationship with a doctor. So, you know, my appointment was at 10 o'clock. I got there 9:30. They gave me some terrible forms. I filled out those forms. So I went in. The doctor shook my hand, and that was the closest I got to him. After that, he never came. I was dressed like this. I never loosened my tie. I was out there within, I went to see him at 10:05. At 10:17, I was on the street. 10:17. This doctor didn't touch me. He didn't put a stethoscope on me. At one point, he read the papers I filled out and he said, oh, so you'd like an HIV test? I said, well, as long as you're going to take my blood, I might as well do an HIV test. He says, oh, we don't need to do the blood. And I'm figuring, what? He doesn't know me. He didn't even take a history. How does he know if, you know, I'm a primary care physician. Does he want to know what my cholesterol is? Doesn't he need to know my PSA? You know, all right. So how has medicine changed? What are we teaching today? We're teaching students to sit in front of computers and order tests. We're not teaching them to sit in front of an individual and engage them. You know, before I order any test on you, I ought to know what the answer is likely to be. I need to know how to interpret that test. And guess what? If you don't trust me, whatever I tell you, you're not going to believe anyway. If I told you the test shows X and you need medicine Y, you won't take medicine Y if I don't know you. How would you know that I need medicine Y? So there is a relationship that needs to form between the healer and the individual who presents himself to be healed. And, you know, we talked earlier about my colleague, Dr. Kokai. He spends time with his patients. He spends a lot of time with his patients. They trust him. And I hope my patients trust me because I spend time with them, and I want to spend more time with them. I wish I could spend more time, but it's certainly not 10 minutes. You know, it takes 10 minutes for me to say hello, and takes another 10 minutes for me to talk to you and find out what's going on. Takes another 10 minutes to examine you thoroughly, and it takes 10 minutes to come back in and talk to you and recap everything, and it takes another 10 minutes to get you out. If you add all those 10 minutes up, you're close to an hour, and sometimes more. That's what it takes. doctors don't spend that kind of time anymore. We don't teach the new doctors that they need to do that. It's so that's what's different within the last 10, 20 years.
What happens, talking about trust? What happens when that trust breaks down?
Well, most of the time, with the relationships that physicians today have with their patients, it's not that the trust breaks down, it's that the trust was never there. You see, that's the problem. They never engaged with HMOs, which and these plans, which now the patients don't go to see the doctor anymore. They go to the center, or they're not part of a physician's group of patients anymore. They're part of a plan, and they see the physician or the health practitioner as somebody associated with the plan. When I dropped most of my commercial insurances, the patient says, "Oh, you're dropping me." I said, "No, I'm not dropping you. I'm just no longer accepting that insurance as a method of payment. I'm right here. The relationship that I have with you, the relationship between a doctor and a patient is not a contract. The relationship between a physician and an insurance company is a contract. They're two different things. The relationship between a patient and a physician is a relationship. Whether or not we explicitly decided we're going to do something, the mere fact that you present to me, I am vulnerable, I am ill, or I need advice, and I present myself, I'm a physician, I'm a knowledgeable person, I am here for you. That's a relationship that takes time, that needs to develop. And after a couple of times, then maybe you will begin to develop trust, and I will be able to give you a therapy that will work. He who the patient trusts is the one who heals best.
And Dr. G in the chat room said, my impression is that people like me are becoming more and more leery of taking prescription medication. Have you encountered such patients? How do you respond to them?
All right. Well, a prescription medication is generally a drug that could harm you. So you should be leery about taking any prescription, right? That's why it requires a doctor's authorization. It's not something that, anybody should do on their own. So when I prescribe, I should have some knowledge of the drug, its side effects, and its effects. Not every drug is going to be effective for every problem. So I must make a diagnosis, and I must know the level of efficacy of this particular drug. I must also know the side effects. And you, the patient, you need to trust me that I know that.
There goes that trust again.
The fidelity to the trust. If I am ignorant and I don't know about the medicine, I shouldn't be prescribing, and you shouldn't trust me. So I need to demonstrate to you that I'm competent. I also need to demonstrate to you that I'm not gonna harm you. I'm not gonna give you too much of this drug, and I'm also gonna give you the right amount, and I'm gonna stop when the drug is doing something that it shouldn't, and I'm gonna keep track of what I'm doing. A drug may be effective for a week, but may be dangerous at 2 weeks. So I need to keep track. If I'm going to add another medicine, I must know that this medicine is not going to interact with the first medicine, so I must keep track. Hence, maybe a couple of things. One is I love plants. I have a green thumb. I can grow anything.
Oh, really?
Oh, yeah, I can grow anything. And I think it's akin to, taking care of people. These are living things. If you can make something grow and, then I think that's a good thing. So I pat myself on the shoulder when I grow a nice, beautiful plant. And plants are just like people, they grow old, they die, you just gotta let them go. But then while they're here, you gotta make them flourish, you gotta let them bloom, you've gotta make them shine.
What is it about your work that feeds your spirit?
I guess we come back to that word, success. The success feeds my spirit. What is success for me? Success is when a patient comes in and their blood sugar is out of control, their A1C is at 10 and 12. The A1C, that's the average glucose that we use to measure how a person is doing with their diabetes. And you tweak the medicine, you give them an exercise program, you give them a diet, and they come back and that A1C comes down and it gets below 7 and it gets to 6.5 and it gets to 5, it gets to normal. And you say, this person was on the wrong road, and you sort of help them get on the right road, and it wasn't, and it's not all about the drugs, it's about the relationship. And there may be drugs, and there usually is a drug that's involved in getting the diabetic under control. So that's success. Success is when the patients don't get heart attacks and they don't get strokes. You don't see that. You don't see what you don't get, right? You don't see it. You just didn't get it. So, when I can say that, gee, I can't remember one of my patients getting a heart attack. I can't remember the last patient that got a heart attack. I can't even remember the last patient that got a stroke. That's not me. I didn't stop them from getting the heart attack and the stroke. No, they did. But I helped them get to that point. So that's success. That's what really, gets me going. So, having those conversations, having a conversation with you, talking about medicine. I love to talk about medicine.
What do you do on your days off?
I read medicine. No, what I do on my days off. That's a really good question. You really dig it. What I do on my days off is I go to the office and I do maintenance. I do the maintenance work. I'm the maintenance guy in the office, which means I prune the plants, I fix them, I do all kind of things. I may go for extra long walks on my days off. I don't play golf. I don't play tennis. So I go for an extra long walk. I may do a 4-hour walk or a 5-hour walk. I may do, instead of doing my usual, I may do 5, 6, 10 miles. That's my regular thing. I may do a 15-mile walk. That takes me quite a while, and then when I come back, I'm kind of beaten up, so I gotta go back into bed for a while. So I'll do that. That's the kind of thing, and of course, I still get out to the parties and stuff like that.
Okay, that's good to know.